it's a beautiful day and I want to spend as much of it as I can outside.
Yeah, we're glad to have you here.
It's my pleasure.
Do you have any personal connections with diabetes?
There's some diabetes in my family, but it was all later onset, so type 2, and unfortunately on my mother's side of the family a number of alcoholics, and so it was actually alcohol induced. Yeah. So
a lot of lifestyle.
Yeah, a lot of lifestyle issues. I guess my connection with diabetes is more about the young kids that I see who are not establishing lifestyles that I think are going to be healthy for them. And my granddaughter's father comes from a family, he's an Aboriginal, and he comes from a family with a lot of people who have developed diabetes later on. So my daughter is very conscious of making sure that Olivia has a good diet and establishes good patterns from the time she's little. So
yeah, it's great to have that support from your family. And another thing with the election coming up, and I'm sure you're hearing a lot about it, a lot of questions about what you have to consider in the election coming up. I know that Dave asked Rob Oliphant about his considerations in the election with a lot of things that diabetics have to pay for, especially their diabetic supplies, which
so we've put the insulin, we've made the changes to the insulin pump support. I guess from my perspective, one of the most important things we need to do as a provincial government is make sure that we put the policies in place and the supports for prevention. So when I was the Minister of Education, we developed new nutrition guidelines for school cafeterias to make sure that there were good options available for kids, and no French fries, and I know that kids will go out and they'll go to stores or whatever, but I really believe that parents at home and school can establish a framework for kids and establish those habits early on. The other thing we did was we mandated 20 minutes of physical activity a day for elementary kids. Now, that's working very well in schools where there's a teacher who is enthusiastic enough to make sure it happens. But I think it's a really good policy, and it's something that we need to reinforce.
I was talking with one of the Canadian Diabetes Association volunteers, and he also volunteers at diabetes camps for kids with diabetics. And he was talking to me about some stories he'd heard from these kids about bullying in school, and kids and also teachers that don't really understand much about the disease, and they feel a bit ostracized because of that. Is there something that government officials, politicians can do with maybe providing more support, more education in schools?
Well, I think there is. I also think that there are other organizations like teachers' federations and maybe, teachers' federations, and there's an organization called OFEA, Ontario Physical and Health Education Association, and I think that those organizations working in conjunction with government can provide resources for teachers. Certainly as we move into election mode, we're developing our platform, and one of the things that I have put forward to the powers that be who are writing the platform is that we need to focus more on prevention and education. And so if we're going to be the healthiest province in the country, right? And we're going to be the healthiest country in the world, then we've got to do that prevention education.
Absolutely.
And so I think that there's a lot more that government can do to support community organizations, to support families, and to support schools to make sure kids have the information that they need. And it's not just information, it's lived experience, because I really believe if children learn to behave in a healthy way, to eat healthy food and feel good when they're little, they're going to constantly through their life going to be looking for that feeling again, But if you never have that feeling, if you never know what it's like to be fit, then it's hard to get back to it because you've never been there when you're 45 years old,
Absolutely. So it's so important to have that support.
It's got to be established early on. And we've got a lot of things working against us. We've got fear of the street, people are afraid to let their kids play outside. They're afraid to let their kids walk to school. Organizations like the walking school bus, it's really important to help kids once again be able to walk to school because they're walking with a group and not have their parents drive them to school. Those kinds of things, they sound small, but if a kid walks a kilometer each way to school every day, that's exercise,
it's an effort,
right?
Yeah.
And so I think there's a lot more we can do.
I talked to Rob Oliphant about private versus public healthcare systems. Can you say anything about your party and what you would support?
We are totally committed to a publicly funded healthcare system. We're totally committed to universal access, and that has been and will continue to be our position. But what I will say is that we've got to find a way in our healthcare system to make the very most of the dollars that are available, and we have to have a rational discussion in this province, and I would suggest in the country, about what the healthcare system can be expected to do and what it can't be expected to do, you know. And I don't even know what the parameters of that discussion would be, but we've got to talk about it, because in 1969, when we brought in universal health care in the country, we didn't really put in a mechanism that said, as there's all this new technology and as there's all this new medication, how are we going to deal with that? And we didn't talk about an aging demographic. You know, we didn't talk about the fact that people my age, I was born in 1953, we're going to be the majority very, very soon in terms of seniors. And so that demographic is going to put a real strain on the healthcare system. So we're committed to universal healthcare, but we are also committed to making it sustainable over the long term, because I want it to be there for my granddaughter.
Good. Yeah. I'm really glad to hear that, and I really support a lot of your views, and thank you so much for being here today. And
You're very welcome.
Us.
Okay, thank you. Great.